Welcome to Anatomy and Physiology. So for this week, we will be discussing about the respiratory system. So let me read first the learning outcomes for this week. First, describe the functions of respiratory system. Describe the anatomy of respiratory passages, beginning at the nose and ending with the alveoli. Third, describe the structures of each part and organ involved in the respiratory system. Fourth, explain the respiration and distribution of air in the body. And lastly, explain important role of respiratory system to other systems in the body. Respiration includes the following processes. First, ventilation or breathing, which is the movement of air into and out of the lungs. Second, the exchange of oxygen and carbon dioxide between the air in the lungs and the blood. Third, the transport of oxygen and carbon dioxide in the blood. And lastly, the exchange of oxygen and carbon dioxide between the blood and the tissues. Now let's proceed to the functions of your respiratory system. First, we have respiration. So when you say respiration, it can be confusing to hear that term alone because sometimes it also refers to cellular metabolism or cellular respiration. So in fact, the two processes are directly related. So breathing provides the oxygen needed in cellular respiration to make an ATP from glucose, and breathing also rids the body of potentially toxic carbon dioxide. So in addition to respiration, the respiratory system performs the following functions also. The regulation of blood pH. The respiratory system can alter blood pH by changing blood carbon dioxide levels. Next, we have voice production. Air movement past the vocal cords makes sound and speech possible. Next, we have olfaction. The sensation of smell occurs when airborne molecules are drawn into the nasal cavity. And lastly, the innate immunity. The respiratory system protects against some microorganisms and other pathogens, such as viruses, by preventing them from entering the body and by removing them from respiratory surfaces. The respiratory system has two divisions, the upper respiratory tract and the lower respiratory tract, as seen in the image. The upper respiratory tract includes the nose, the pharynx, or the throat, and the larynx, while the lower respiratory tract includes the trachea, the bronchi, and the lungs. Keep in mind, however, the upper and lower respiratory tract are not officially anatomical terms. Rather, they are arbitrary divisions for the purposes of discussion, and some anatomists define them differently. Even though air frequently passes through the oral cavity is considered part of the digestive system, not the respiratory system. So let's discuss first the nose. So the nose consists of the external nose and the nasal cavity. The external nose is the visible structure that forms a prominent feature of the face. Most of the external nose is composed of hyaline cartilage, although the bridge of the external nose consists of the bone. The bone and the cartilage are covered by the connective tissue and skin. The nares or nostrils are the external opening of the nose, and the guanae or funnels are the openings into the pharynx. The nasal cavity extends from the nares to the guanae. The nasal septum is partition dividing the nasal cavity into right and left parts. A deviated nasal septum occurs when the septum bulges to one side. The hard palate forms the floor of the nasal cavity, separating the nasal cavity from the oral cavity. Air can flow through the nasal cavity when the oral cavity is closed or full of food. Three prominent bony ridges called conchae are present on the lateral walls on each side of the nasal cavity. The conchae increase the surface area of the nasal cavity and cause air to churn, so that it can be cleansed, humidified, and warmed. The paranasal sinuses are air-filled spaces within bone. They include the maxillary, frontal, ethmoidal, and sphenoidal sinuses, each named for the bones in which they are located. The paranasal sinuses open into the nasal cavity and are lined with a mucous membrane. They reduce the weight of the skull, produce mucus, and influence the quality of the voice by acting as resonating chambers. So what are the functions of the nose? First function of your nose is for filters. Next, airway for respiration. Involved in speech, olfactory receptors. It warms air, and sneezing dislodges materials from nose. Next, we have the pharynx. The pharynx or throat is the common passageway for both the respiratory and digestive system. Air from the nasal cavity and air, food and water from the mouth pass through the pharynx. Inferiorly, the pharynx leads to the rest of the respiratory system through the opening into the larynx, and to the digestive system through the esophagus. The pharynx is divided into three regions: the nasopharynx, the oropharynx, and the laryngopharynx. The nasopharynx or nasopharynx is the superior part of the pharynx. It is located posterior to the guanae and superior to the soft palate, which is an incomplete muscle and connective tissue partition separating the nasopharynx from the oropharynx. Next, the oropharynx extends from the uvula to the epiglottis, and the oral cavity opens into the oropharynx. Thus, food, drink, and air all pass through the oropharynx. The oropharynx is lined with stratified squamous epithelium, which protects against abrasion. Lastly, we have the laryngopharynx. Passes posterior to the larynx and extends from the tip of the epiglottis to the esophagus. Food and drink pass through the laryngopharynx to the esophagus. A small amount of air is usually swallowed with the food and drink. Swallowing too much air can cause excess gas in the stomach and may result in belching. The laryngopharynx is lined with the stratified squamous epithelium and ciliated columnar epithelium. You can see the medial view of the sagittal section through the nasal cavity and pharynx. Now let's proceed to your larynx. The larynx is commonly called the voice box. It is located in the anterior throat and extends from the base of the tongue to the trachea. It has three main functions. First, it maintains an open airway. Second, protect the airway during swallowing. And third, produces the voice. The larynx consists of 9 cartilage structures, 3 singles and 3 paired. The cartilages are connected to each other or to one another by muscles and ligaments. The first single and largest cartilage is the thyroid, or the shield-shaped cartilage, or also known as the Adam's apple. The thyroid cartilage is attached superiorly to the hyoid bone. The second single and most inferior cartilage of the larynx is the cricoid cartilage, or the ring-shaped cartilage, which forms the base of the larynx on which the other cartilages rest. The thyroid and the cricoid cartilages maintain an open passageway for air movement. The third single cartilage is the epiglottis. It differs from the other cartilages in that it consists of elastic cartilage rather than hyaline cartilage. Its inferior margin is attached to the thyroid cartilage anteriorly, and the superior part of the epiglottis projects superiorly as free flap toward the tongue. The epiglottis protects the airway during swallowing. It prevents swallowed materials from entering the larynx by covering the glottis. As the larynx elevates during swallowing, the epiglottis tips posteriorly to cover the glottis. The 3 pairs of cartilages are on each side of the posterior part of the larynx. The top cartilage is the coniform or the wedge-shaped. The middle cartilage is the corniculate or the horn-shaped, and the bottom cartilage is the arytenoid or the ladle-shaped cartilage. The arytenoid cartilages articulate with the cricoid cartilage inferiorly. The pair cartilages form an attachment site for the vocal folds. The larynx also houses the vocal cords. There are two sets of ligaments that extend from the posterior surface of the thyroid cartilage to the paired cartilages. The superior set of ligaments forms the vestibular folds, or false vocal cord, and the inferior set of ligaments composes the vocal folds, or true vocal cords. When the vestibular folds come together, they prevent air from leaving the lungs, as when a person holds his or her breath. Along with epiglottis, the vestibular folds also prevent food and liquids from entering the larynx. The vocal folds are the primary source of voice production. Air moving past the vocal folds causes them to vibrate, producing sound. Muscles controls the length and tension of the vocal folds. The force of air moving past the vocal folds controls the loudness, and the tension of the vocal folds controls the pitch of the voice. An inflammation of the mucous epithelium of the vocal folds is called laryngitis. A swelling of the vocal folds during laryngitis inhibits voice production. Now let's proceed to your trachea, or the windpipe. Allows air to flow into the lungs. It is a membranous tube attached to the larynx. It consists of connective tissue and smooth muscles, reinforced with C-shaped pieces of hyaline cartilages. The adult trachea is about 1.4 to 1.6 centimeters in diameter and about 10 to 11 centimeters long. It begins immediately inferior to the cricoid cartilage, which is the most inferior cartilage of the larynx. The trachea projects through the mediastinum and divides into the right and left primary bronchi at the level of the fifth thoracic vertebra. The esophagus lies immediately posterior to the trachea. The trachea is lined with a mucous membrane. This membrane consists of pseudotrastified columnar epithelium containing numerous cilia and goblet cells. The cilia sweep the mucus embedded with the foreign particles into the pharynx, where it is swallowed. Constant or long-term irritation of the trachea by cigarette smoke can cause the tracheal epithelium to change to stratified squamous epithelium. The stratified squamous epithelium has no cilia and therefore cannot clear the airway of mucus and debris. The accumulations of mucus provide a place for microorganisms to grow, resulting in respiratory infections. Constant irritation and inflammation of the respiratory passages stimulate the cough reflex, resulting in smoker's cough. Now let's proceed to your bronchi. The trachea divides into the left and right main bronchi, or primary bronchi, each of which connects to a lung. The left main bronchus is more horizontal than the right main bronchus because it is displaced by the heart. Foreign objects that enter the trachea usually lodge in the right main bronchus because it is wider, shorter, and more vertical than the left main bronchus, and is more in direct line with the trachea. The main bronchi extend from the trachea to the lungs. Like the trachea, the main bronchi are lined with pseudo-stratified ciliated columnar epithelium and are supported by C-shaped pieces of cartilage. Now let's proceed to your lungs. The lungs are the principal organs of respiration. Each lung is cone-shaped with its base resting on the diaphragm and its apex extending superiorly to a point about 2.5 cm above the clavicle. The right lung has three lobes, the superior lobe, the middle, and the inferior lobe, while the left lung has two lobes called the superior and the inferior lobe. The lobes of the lungs are separated by deep, prominent fissures on the lung surface. Each lobe is divided into bronchopulmonary segments, separated from one another by connective tissue septa. But these separations are not visible as surface fissures, because major blood vessels and bronchi do not cross the septa. Individual diseased bronchopulmonary segments can be surgically removed, leaving the rest of the lungs relatively intact. There are 9 bronchopulmonary segments in the left lung and 10 in the right lung. From that image, you can see a terminal bronchial branches to form respiratory bronchioles, which give rise to alveolar ducts, then alveolar connect to alveolar ducts and respiratory bronchioles. The alveolar ducts end as 2 or 3 alveolar sacs. So the alveoli is a small air sacs where gas exchange occurs, surrounded by capillaries with 300 million in lungs. Alveolar macrophages phagocytize any particle that gets deep into the lungs. Type 2 or alveolar cells antimicrobial secretion protects against foreign microbial invasion. Now let's proceed to the lung airway passages. So structures become smaller and more numerous from primary bronchi to alveoli. So from the primary bronchi, each main bronchus divides into lobar bronchi, or your secondary bronchi, as they enter their respective lungs. The lobar bronchi conduct air to each lung lobe, and there are 2 lobar bronchi in the left and 3 for your right lung. The lobar bronchi in turn divide into segmental bronchi, or your tertiary bronchi, which lead to bronchopulmonary segments of the lungs. The bronchi continue to branch many times, finally giving rise to bronchioles. The bronchioles also subdivide numerous times to give rise to terminal bronchioles, which then subdivided into respiratory bronchioles. Each respiratory bronchiole subdivides to form alveolar ducts, so the long branching ducts with many opening into alveoli. Then the alveoli, or your hollow sacs, are small air-filled chambers where the air and the blood come into close contact with each other. The alveoli become so numerous that the alveolar duct's wall is little more than the succession of alveoli. The alveolar duct ends as 2 or 3 alveolar sacs, which are chambers connected to 2 or more alveoli. Relaxation and contraction of the smooth muscles within the bronchi and the bronchioles can change the diameter of the air passageways. For example, during exercise, the diameter can increase, thus increasing the volume of air moved. During an asthma attack, however, contraction of the smooth muscles in the terminal bronchioles can result in greatly reduced airflow. In severe cases, air movement can be restricted that death results. Fortunately, medications such as albuterol help counteract the effects of an asthma attack by promoting smooth muscle relaxation in the walls of terminal bronchioles so that air can flow more freely. The respiratory membrane of the lungs is where gas exchange between the air and blood takes place. It is formed mainly by the walls of the alveoli and surrounding capillaries, as you can see from that image. To facilitate the diffusion of gases, the respiratory membrane is very thin. It is thinner than a sheet of tissue paper. The respiratory membrane consists of 2 layers of simple squamous epithelium, including secreted fluids, called alveolar fluid, and separating spaces. The individual layers are the following: a thin layer of alveolar fluid, the alveolar epithelium, composed of a single layer of cells, simple squamous epithelium, the basement membrane of the alveolar epithelium, a thin interstitial space, the basement membrane of the capillary endothelium, and the capillary endothelium, also composed of a single layer of cells, simple squamous epithelium. The elastic fibers surrounding the alveoli from that image allow them to expand during inspiration and recoil during expiration. The lungs are very elastic, and when inflated, are capable of expelling the air and returning to their original inflated state. Specialized secretory cells within the walls of the alveoli, as you can see also from that image, secrete a chemical called surfactant that reduces the tendency of alveoli to recoil, or what we call lung recoil, later in this discussion. Now let's proceed to the pleural cavities and membranes. So from that image, you can see the transverse section of the thorax showing the relationship of the pleural cavities to the thoracic organs. Each lung is surrounded by a pleural cavity. The parietal pleura lines the wall of each pleural cavity, and the visceral pleura covers the surface of the lungs. The space between the parietal and visceral pleura is small and filled with pleural fluid. So that ends the first part of our topic for this week about respiratory system. I hope you learn to appreciate the importance of this system and take more time to read it by heart. Thank you.